Hey, great to see both of you, Gary and Siva. Thank you for joining me for this conversation. When we started the firm about a decade ago, the strategy was to serve entrepreneurs who are reinventing and transforming the business of healthcare. Today, we manage about $1 billion and have invested in nearly 60 companies. Cohere is clearly one of the standout success stories in our portfolio, and wanted today to talk a little bit about the journey of Cohere, as well as some of the lessons learned, some of the key decisions we made along that journey together. And as such, really eager to have Gary join, who's been serving as executive chair since the formation of the company. And Siva, you've been the CEO since the formation of the company. And it's clearly been one of our strongest performing investments. It also came out of a strategy we had with one of our important partners, Humana, around co-creating companies together that were essentially at the outset, certainly purpose-built to solve really important needs in the market. And Siva, you were wonderfully articulate in thinking about the use cases for prior authorization. And then since setting up the company a few years ago, the AI phenomenon has overwhelmed the marketplace. And so we'll obviously touch on the impact of those new capabilities. There are a handful of topics I want to address. We'll go through them systematically, but maybe just at the beginning, could the two of you just briefly introduce yourselves?
I'm Gary Gottlieb. I'm the executive chair of the company. I'm a geriatric psychiatrist and professor of psychiatry at the Harvard Medical School. I'm an executive partner at Flair Capital Partners, and I was the CEO of the Mass General Brigham Healthcare System and the CEO of Partners in Health, the global health organization, providing care in some of the poorest parts of the world before I joined Flair.
Perfect. And Siva?
Hi, good afternoon, Michael and Gary. I'm Siva, Namasivayam, CEO of Cohere Health. I am an engineer by training. I have been in health tech for more than 25 years. My last venture before Cohere, again, was a company that I started in 2008, doing analytics and data work for health plans. And so this actually is an extension of what I started, I would say, about 13, 14 years back.
Terrific. Maybe I'll just start with you. Prior authorization, maybe for the audience, give a little sense of how you think about that. Why did we start around prior authorization? Just give a little bit of context from the beginning of the company.
Prior authorization is a very complex process that goes on between the various players in the healthcare industry. It starts off with the patient walking into a provider asking, or the provider diagnosing that the patient has to go through a certain procedure, and then they need to ask the payer for authorization of that. That's the simplest way to say that. However, there are so many nuances around this, and the process is very complex because, first of all, you have to actually gather all the information. And then second is, once you gather the information, you need to be able to make a decision on that. And if you are not able to make a decision, you need to actually consult with the experts, and the experts have to render the decision. It's easier said than done because of the complexity of healthcare with the numerous procedures, etc., that has been going on. Companies have been attempting to solve the process for more than 20, 25 years, but it has gotten even more complex with complex systems, etc. But the most important thing, though, this affects patient care. The patients get delayed because of the time that it takes to render a decision. And that has been one of the issues that the healthcare industry has been trying to solve. We decided that, okay, let's start off with that. How can we make this process really simple and very timely for patients? Because both the providers and the payers want to solve the problem because they don't want the patients to suffer. But they were suffering. And when you ask physicians, they will say 97% of the physicians and 97% of the office administrators, they will say that this is affecting the care delay. So we decided to embark on this to come up with the best solution possible.
Yeah. And Gary, you've run some of the most notable hospitals in the country. What would you add to that initial vision? We've obviously tried to expand the vision to be more around clinical intelligence, and you were there at the very beginning.
Yeah, I think what compelled me about this is that prior auth is probably the biggest pain point and friction point between payers and providers, two separate fiduciaries around the precious nature of care and the patient experience. And from a provider's perspective, it's been an opportunity that payers have used to create barriers to access when it's been necessary, and a second guessing of clinical decision making clinical decision-making being made by people who are deeply learned and are embedded, and their entire life's work is around trying to figure out solutions for patients and intervene appropriately. So there's been something that's been both negative, insulting, and difficult in that regard. To some extent, the reason why Humana came to Flare to try to solve this problem together in forming a company that was based upon work that they had been working on for a period of time is that they thought that friction was, as Siva was describing, disruptive to patient care, undermining members. And the process itself, as Siva was describing in terms of trying to find greater efficiencies, was also quite opaque. So providers had no idea what would be approved or wouldn't be. It was deeply patient disruptive. So patients would come in and providers would say, I want to do this, but the insurance company is telling me I can't do that. And the question is, how could we create a solution that was very patient and provider centered, that was completely transparent, that provided all that was necessary for providers to know as to how something could get approved, and partner with the evidence base, with people who could create guidelines and evidence and create and automate that function and use data to inform decision making.
Yeah. And so it's a chaotic time in the marketplace, as we all well know. And Gary, you've seen some of our analysis internally. We've plotted capital efficiency over time for each of our companies as they go along that journey. And there's an inflection point when they hit product market fit, where the models start to really scale very quickly. It's super exciting to hit that inflection point. Why don't both of you just reflect on the first couple of years of the journey as we figured out what were the appropriate product features, capabilities, how the market was beginning to think about these capabilities. And maybe, Siva, you were obviously on the front line of talking to a lot of these potential customers. How did you think about product market fit?
We started off with one client that's a great client, and we focus on solving a very specific use case for them around MSK. And the results from that were very good. Actually, we hit on all the factors. They were looking for provider experience. We got 65 NPS right off that bat. And the providers reported that the patients were getting the care in 1 or 2 days, the next best care, compared to 7 or 8 days that it was taking them. And obviously the payers, they also said that they were actually getting their outcomes, right, in terms of both medics, etc. So once we got that, we wanted to take that particular value proposition to the market. So we had plenty of conversations, thanks to Player and the network and our other investors. We were able to have executive conversations, actually taking that product to the market. There were no takers initially because people said, oh, prior auth, I know that it's a pain point, but there is no urgency to solve it. We are focused on value-based care. We are focused on the other pieces. So we think that prior auth will go away, etc. So we are not worried about it. We said that, okay, are we in the right space, or what is the problem that we are trying to solve? But what happened was, I would say that around that time, the regulations actually, in some states like California and in certain states, Texas, they started actually looking at it and they were trying to come up with problems. So then it started getting into the radar of actually a lot of the health plans. I would say in the second year, we have a great head of solutions. He said that there seems to be multiple problems in this market, and we are solving the patient care and the patient journey, etc. But we think that it's a pyramid of problems: compliance, administrative expense, then medex, then provider experience, then nirvana, right? We were actually at the top of the pyramid for our best customer. When we started talking to the market, what we found out is that they were more concerned about compliance and administrative. They said that, you know what, you guys are offering great, but I am still living on faxes and I don't have any of the connectivity. So can you help me there? And we said that, is this a one-time problem or is it something that everybody has? And we found out that pretty much most of the market had that problem. So we quickly pivoted to selling our product because people liked our technology that we developed. So what we said was, let's take the technology platform and now let's get to the second and the third client. And that's how we started taking off.
And so, Gary, maybe reflect, or what advice would you offer entrepreneurs in this kind of awkward adolescence phase where you're trying to figure out the sweet spot of the market? What were some of the lessons you took from this?
I think that there are a few. One, listen very carefully. Understand how hard it is to choose a vendor, how much work it is, who the decision makers and the champions might be, what are the various issues within a broad and diverse enterprise-like company, which all of these payers are. They're big. They have a tough time making decisions. They're sitting with old data solutions. So understand how much of a step it is to rip something out and make something new. The second piece is who's going to be affected by it. When you're starting to talk about prior auth, it's one of very few tools that payers have to control total medical expense. And their actuaries are concerned about it. So leaving a vendor that may be inadequate, may be inefficient, but has created savings in terms of trend will create a high degree of fear. How should I trust these guys? And who are these new people? No matter how brash they are. And there's got a show me component of this. Show me that you can create some savings. Provide demonstrable evidence that you can both improve trend, be transparent, have a great provider experience, and create each of those dimensions. And don't try to sell me everything at once. Help me find the solution administratively and walk the way up. Additionally, as investors and as a board, be patient before we kind of get that traction, because it takes a few minutes to be able to get decisions to be made.
Yeah, and one of the common complaints in the marketplace is it's littered with point solutions. So Siva talked about a narrow solution having to go broad. How did you think about that dilemma as to how much capability, and we're capital constrained in the early days, to be narrow versus broad? How do you let the market define where you should end up on that continuum?
Well, I think to some extent, understanding what doors they're willing to open for us, so that if it's going to be a point solution, we have to be able to show that it has an enduring effect over a period of time that'll create ROI relative to the investment. And I think from day one, Siva and the team focused on being able to demonstrate ROI associated with the intervention, and at the same time doing it without friction. If we had used the ordinary approaches that were full of friction with providers, we probably could have shown ROI relatively quickly, but there'd been no reason to make a change. As we were starting to do that, tailwinds started to occur. We heard there were political voices at state levels and at the federal level that started to say, this is a big problem. And it became a number one or number two priority at the AMA for every provider to focus on getting rid of prior auth or changing utilization management. And we could easily resonate with that. So one of the other things that we did around trying to make sure that it was clear we were going to fit the marketplace is we partnered with provider groups so that there would be a notion that guidelines or other elements that we were going to be using were consistent with the forces that we're trying to push away from prior auth, because that same pushback payers were getting in their own communities, particularly smaller payers.
I want to come back to the ROI calculus that the market's focused on, but Siva, let's talk a little bit about the team that you built. And the teams go through an evolution. There's certain capabilities that you need at the beginning that are less relevant over time. But how did you think about some of the early team ads? And again, with the eye towards lessons learned, advice to other entrepreneurs, what were some of the things you think you did particularly well in the first couple of years?
First of all, we assembled a great team that are go-getters, that are able to change very fast and get the feedback from the market and change, and that are a little bit more generalists, that can do multiple things. That was actually how we built the team, and the team was very agile. We were listening to the client all the time, and we were ready to make changes. So that is the evolution. But once we started finding the traction, I felt that we needed more process discipline. We need people focused on one process. So the generalists sometimes like to do everything, right? We needed to find people who have deep expertise, who want to just focus on the function and make it much better. So that's a transition that started happening in the end of second year, third year of the company. And glad that we did. One of the biggest lessons learned is, now that I look back, is some of it I should have done earlier, because we were waiting to make sure that, hey, when are we going to hit product market fit? You never know. It just comes to you. It's not like on a particular date, right? So you just have to be constantly thinking, and it's the right time. It's all based on how you feel about the market, what the clients are saying, and when is the right time. That comes to the entrepreneur and the management. This is the right time.
Yeah.
That's a time. Don't wait. Just do it.
Yeah. Gary, obviously you've run big organizations, little organizations, executive chair of Cohere. How did you think about the team construction, which, without sounding too gratuitous, is one of our most complete, highly functional teams in our portfolio?
So it's kind of interesting because we started completely from scratch, and we had problems that needed to be solved immediately because of taking on a structure that had been created by someone else and was going to be made commercial. And so we needed expertise in technology almost as rapidly as we needed an understanding of the insurance business, because we needed to have technology vehicles created and to invest in technology very early on. And we had to then be able to build team that had clinical expertise. And I must say that from the very beginning, Siva approached it with a very high degree of humility. So we hired a very senior clinician to be a chief medical officer and the focus in our first product was musculoskeletal care. We hired a board certified orthopedist who had worked for years actually with Humana and with other payers in value-based care and had a great reputation in understanding the tension that existed in this regard. And we were able to partner him with people who were working on understanding the process of care, the care journey, and being able to then create a technology platform to be able to support that, and who could be empathic with practices as they were having difficulty jumping onto technology where they had analog or fax solutions beforehand. So that was very important. And we also paid a lot of attention to the first customer. So we had a first customer who was a sponsor, who was basically giving us a master's degree in prior authorization and utilization management. So we needed to learn to also understand that, we were going to basically step in it with them as we were moving things forward. And I think that kind of humility is critical with any startup in this regard as you're building team and as you start to delegate those resources and empower team members. Siva was describing a couple of years later was really starting to move to scale. And that is another kind of tension.
Yeah, I think that one thing is that definitely, I think the role that our first client played is substantial. They had team actually dedicated to dealing with Cohere. And as Gary said, very experienced people who probably some days go back and say, what the hell are these guys talking about? But they were very passionate also, and they really helped us. I think I should just say that collaboration was one of the keys, right?
Points of I say all the time that great people always attract capital, even in difficult markets like the one we have today. It's compounded by the complexity we're seeing with new AI technology. So you built an incredible team, and yet the landscape starts to shift very quickly with some of these new capabilities. How did you have to recalibrate the team to address now these new capabilities coming into the market, these new demands?
That's a great question. The good thing is that when we started, based on my background, in fact, I think that's probably why I joined, is around data and analytics, the world of data where things change constantly, right? And so we actually had that mindset and said that is going to be one of the key differentiators for us going forward. We had a small team, because the focus was getting the product to the market and to solve very specific problem, right? So we had a small team that was focused on assembling the data, but we started making small investments in key decisions, right? For example, how can we extract information from the medical record? So we used, I would call the version 1 of AI. Right now, we are in the 3rd generation. Within the company, we are about 5 years old. We are already in the 3rd generation of AI. When we started, we were in the 1st generation, which was around NLP and things like that. But then, as I said, as we moved towards a platform, we started looking at how the latest and greatest things are coming through. So then we started pivoting more into investing a lot more in that. We were probably one of the earliest companies that actually got machine learning and AI engineers and specialists in clinical doctors, MDs. We put them together. That's the key. I think we put them together to say that because we are in the clinical decision-making process, how can we make sure that technology is there, but how can it be precise? How it is actually the clinicians who are vetting the information. So that became a very important aspect of our business, and the clients started to like it. So that's how we started keeping up. And now our entire company, I would say that quite a bit of people are focused on AI because we saw that the AI use cases can deliver ROI. And we are seeing it in our use cases every day. So that's when we said, okay, we need to scale up and we need to actually put more resources into it.
You mentioned ROI. I'd like both of you to reflect on that. We're at such an early phase of this market adoption. How are our customers calculating ROI? How do they think about what they should pay for these types of solutions?
Actually, the good thing is that we are in the health plan market. They are very focused on financial outcomes. So we actually built up an organization which is actually taking their current state, mapping it to what we can accomplish. We develop a business case, which is at least from an administrative perspective, at a minimum, it delivers 3-to-1 or 4-to-1 ROI. And there are milestones that the client kind of looks at it and measures us by. And that is the most important thing. In fact, they are not even worried about the other aspect, right? Clinical outcomes and time and all of that. They are clearly focused on financial because that's what the health insurance companies.
And over what time frame do you think they're holding us to? Is that a 1 year time frame? Is that a multi-year time frame?
No, it is actually, things are moving very fast. Some of it could be as short as 6 months. We get a feedback. In fact, more recently, in fact, I got off a phone with a client yesterday, which I was pleased to hear is that, the moment we implemented Cohere, which was the first phase, which is about 3 months, 3.5 months, we are right now saving about $4 million right off the bat. The moment Cohere came in, it's $4 million.
Is it as simple as say it's technology replacing labor, or are there more nuances to that ROI calculation?
Oh, there are very many nuances, right? We go through a big spreadsheet. It's around productivity. How much can the people produce every hour? How many of that can be automated and the decisions can be automated? So they look at that. And then the quality of the decisions. They also look at the other aspects like what is the additional business I can bring in? Because nobody wants to replace people. They want to know how much more business can I bring to the table without adding any more people. So it's a multi-dimensional calculation, which we are now pretty good at. But that's how they look at it. It's not a simple, hey, you replace this many people with technology. No, it's not like that. It's more nuanced than that.
Gary, any other thoughts on ROI?
The beauty here is two-sided, right? You can, one, there's everybody's focus on what does this do to medical loss and appropriateness of care. And actually, appropriateness of care has longer term savings, but in period, utilization of the right resource that fits guidelines is very often less expensive or won't convey complexity onto someone that will have more morbid outcomes and more expense. And then the second piece is, as Siva was describing, the administrative waste that exists. And particularly with smaller and mid-range plans, they don't have the capacity to scale around a variety of those issues. And we can use AI-related tools to create substantial savings in that regard, really from the get-go. And as Siva said to you, we're still sitting in a very analog business. We have all of these very big practices or hospitals and others that are sitting and faxing details to us constantly. So we've created tools that can ingest those data from fax and digitize them so that they can become part of the analytic pool as well, which didn't exist before. So each of those elements all fit in the notion of what's wasted that could otherwise be used either to return to society or to improve care.
Yeah. So bear with me. So this improvement feels profound and more step function, like it's a real shift in their operating cost structures. Conjecture what the next several years for these types of capabilities, how do we continue to show ROI if you fundamentally reset a lot of their workflows? What's on the roadmap?
So actually, you are hitting on something very important, which I've been thinking and our organization has been thinking. What we are finding, though, is that one of the big barriers is change management. We are actually in a complex workflow. What we are learning and what we are finding is that while I think we can push technology out and AI out, the people that are on the other side, they are used to doing things for 20 years, same way. And changing them and getting them, because we have conceived that they can get a 10 to 20 times ROI right off the bat. But what happens is that they are taking it only one step at a time. And we need to be very cognizant of that because these people are really good in certain things. They are clinical, they are licensed, etc. But they are going to suspect technology. So it is going to be incremental and it is going to take time. But if we can show small improvements over a period of time, that's what the clients are looking at this point. They are not asking you to come and deliver the world on day one. They are saying that they are understanding completely that, hey, we are a complex organization. So many people have to change in order for this to be adopted. And so they are very cognizant of that. But we need to deliver value almost every month, every week, so that they see the incremental improvement.
And does that mean we're building new capabilities?
Absolutely. And that is one beautiful thing that we have done right now with our organization. We now have a great organization. We brought in some very experienced chief technology officer, chief product officer, chief AI officer, and they have now figured out how to deploy these solutions very fast. And we learn from the client. In fact, we go spend time. We say that we can come up with a use case and we go back and we come back in a week and say that, and we keep on getting the feedback and then we go back and change. We have 2 week sprints. That's what we do right now. And what we have done is that with AI, And with everything else we do, clinical, we have put all of them into that sprint. So even AI models, we are saying that you have a week sprint. So
Yeah.
you need to make changes to that so that the people can see the difference immediately.
Gary, any other thoughts on our product roadmap, like what the Cohere of 2028 looks like?
It'll probably be the best partner that payers have in terms of all of the critical issues related to kind of payer revenue cycle, fintech, and some of the requirements that society is placing on those payers in terms of their accountability. Many of those relate to the rules and regulations that CMS imposes, but they're immediately translated by insurance commissions and by others, so that in their ability to respond in that regard right now is analog, or it's deeply digging into data and doing things retroactively. They'll be able to proactively use our products that we learned from in prior auth and utilization management, in payer integrity and quality, and in a variety of other critical areas. And that'll be a full suite of products that partnership will allow us to emerge. These payers are becoming development partners with us because to Siva's point, they're saying, this is a problem. Can you help us find a solution? And now we have both the team and the tools to be able to find those solutions rapidly, to prototype them, and to be able to see what the exercise can be with a small population, or do it in the background and see what the outcomes would in fact be.
In fact, I would just say that in the last 4 weeks, when we started showing value, clients come to us with a problem. They said, can you help me with policy management? We are able to now turn things around, appeal support. They said, payment integrity. Looks like you guys have all this data. You can help me with prepayment issues, not post-payment issues that the current market is. So we are already getting into the use case. So it's coming rapidly at us. We are very excited for it, but we are setting up the infrastructure.
You just previewed my last question or discussion topic. As I said earlier, great people attract capital. We have raised and announced a very large Series C last month that also is supported by the size of the market opportunity, is enormous, and the AI phenomenon is obviously very compelling. As you reflected on the successful fundraise, what were some of the key elements of the narrative that you think investors got particularly excited about?
What they got excited about was the fact that we are working on very complex processes, not simple processes that can be disintermediated by all the LLMs, etc. And the second thing is that we are very client focused. It's client centricity, right? We are building something on client back, not on technology first, right? And then the third thing is that we were able to show where we were able to integrate very deep, precise clinical information coming from the clinicians, the MDs, with AI to be able to deliver something that's more trustworthy. So they looked at that, and they then looked at the market opportunity. We were able to demonstrate that we are able to deal with Medicare Advantage plans. We are doing with Medicaid plans. We are doing with commercial plans. And actually, more recently, we have now started working with primary care or fully capitated providers. So they see that, okay, this problem and what they are solving, it's not just prior auth, but it is something even more fundamental around data and how it can actually help with multiple workflows, not just in one type of payer, but it can actually address payers, but also the providers. I think so the market is pretty huge, and that's something that they really bought into.
Gary, can I maybe close with you? You're my healthcare Yoda, so to speak. Given all the AI capabilities that we're now seeing in the market, do you think healthcare spend will go from 18% of GDP to a lower or higher number in 5 to 10 years from now? How do you think the ultimate impact of all of this will be?
I think that healthcare spend will be reduced from 18% of GDP, but not because of AI alone. A variety of issues around policy. Remember, one way or the other in this country and virtually all others, there's a substantial amount of government payment that relates to overall healthcare spend, whether it's in Medicare or Medicaid, directly in governmental payments, or in the tax benefits that relate to essentially healthcare benefits on the employer side. And we have debt that's crowding out other related expenditures, and there's a demand for efficiencies and changing incentives. So the combination of having the tools to be able to see the ramifications of those incentive changes, which AI will provide for us. The notion of removing administrative burden in a variety of ways will enable one to deliver more care more freely. But a variety of the incentives that have skewed this system into being an illness care system rather than a healthcare system will be informed by those data and will move us up the feeding chain, as will payment mechanisms that focus more on value away from those incentives. Let me say that I got into the whole notion of healthcare management, got an MBA after I was already trained in psychiatry because TEFRA was implemented and because I was afraid that healthcare costs would be reduced by the Reagan administration from 8 or 9%, and it would affect the patients I cared about. So I'm not much of a visionary in this regard, but I do think that there are a variety of other levers that are going on at the present time. I think this one is fantastically interesting because all of healthcare is around decision-making under conditions of uncertainty, and ways in which you can embed those decisions, make them more effective and efficient, and trust them simultaneously as the tools become more and more reliable is remarkable. And this company has focused on them as a partner to clinicians, where the clinicians are the stewards, but for the administrative components, allowing the tools to be the partners of administrators. And that's a lot less scary from the perspective of society in being able to embrace something that can make these efficiencies simultaneously. So I'm deeply optimistic.
That's terrific. What a terrific way to end. Gentlemen, thank you. I can't thank you enough for this conversation, but also the great work you're doing in building such an important company. I'm honored to be partnered with you.